So in my discussion at the AM plenary session, I did a brief review of the acute neurological symptoms that we saw with patients who were currently sick with COVID-19. I reviewed what we have seen and reported in the peer-reviewed literature up until this point, what we know. I reviewed all of the key areas of major knowledge gaps where we really desperately need some information. And then I described the GCS-NeuroCOVID consortium and our collaborator, the Energy Consortium, which is founded and coordinated by leaders at the European Academy of Neurology, who we collaborate with closely. And we reported our first analysis of the combined consortia and what we found in terms of neurological symptoms and signs in patients who are currently sick with COVID-19 who were hospitalized. From even the very first report out of Wuhan, China, just a little over a year ago, they already described things like headache, muscle aches, some fairly non-specific symptoms. And, truth be told, at that time, we know very little about this disease. And it was hard to know whether these symptoms were non-specific, just, people had them because they're just really sick, or they actually pinpoint to a specific neurological problem. Since then, there's been more data that has come out. The neurologists in China had looked at the original group of patients who were infected with COVID-19 in Wuhan and found that there are actually a bunch of neurological symptoms, and two in particular were linked to people who had more severe disease. So encephalopathy, which is basically someone who's not themselves, who are either confused or agitated or perhaps had decreased arousal, something wrong with their consciousness, and strokes. Those are the two features that were specifically seen in the more severe patients. Later on, a bigger study came out in China where they had, I think, 3 different regions. They put patients together from 3 different regions and they looked at whether they had neurological symptoms. And they found similar things. They found that the most common neurological symptoms were encephalopathy or stroke, the severe ones. In that study, though, they found very few. They only found, I think, out of almost 900 patients, they found only 39 patients had problems. And since then, there were a lot of reports that came out across the world. People have been reporting strokes with COVID. People have been reporting, problems with nerves like Guillain-Barré syndrome. There are several reports of encephalopathy or various states of confusion and impaired consciousness. But what we didn't know, and what we still don't know is, can we put all of these patients together and in a really large group of patients, really look at what are the most common features of neurological features? And we also need to know how many people have this to get a sense of how big a problem this is. And the reason why that is important is twofold. One is, in any disease, when you impact the nervous system, recovery is sometimes impossible or at best incomplete, or if it's complete, it takes a very long time. So the moment the nervous system is involved, we're looking at a lot of disability, a lot of morbidity, if not death or mortality. So it's important for us to see just, to what extent there are nervous system symptoms. And the other thought, and to be honest, when we first started this GCS-NeuroCOVID consortium at the beginning of the pandemic here in the US, so that last March, my personal hope was that we won't see that many because, for all the reasons we talked about, if once the nervous system is involved, people don't do very well. And then as we're running our study, I became increasingly worried that even if a nervous system involvement is a rare event, if you multiply that by the number of cases we have around the world, it's no longer a small number. And so it became even more important to figure out how many people might get this, what are the major symptoms. It'd be nice to know who are the people who have a predilection for this, so who might be most at risk, so maybe we can direct our resources or neurological resources to those patients. And a big piece is outcome, just what happens to those patients. Does it impact their immediate short-term mortality? What about the long-term? What does that recovery look like? And finally, what is the cause, of the neurological involvement in this disease? And until we figure out the cause, it would be hard for us to find a therapeutic that can potentially help these patients. So these were the major areas that we needed to address.